Welcome to Adapt NCLEX, where content matters and we keep NCLEX simple. Today, we're doing another 85 high-yield NCLEX question that mirror the rare exams from prioritization, delegation, pharmacology, engineering, case study, safety, everything that you need to pass the NCLEX. For every question, I will give you an answer, a clear, simple, rationale, so that you don't have to memorize. Grab a notebook and let's start. So the first set of questions is management of care. We have prioritization, delegation, ethics, and other information. So as usual, prioritization. First thing, who do you see first? Which client in the emergency room waiting area should be seen first? That means you need to prioritize. Look at each situation and see who is in trouble. Risk reduction at the same time, rescue thinking. You want to rescue them from getting sick. What is the problem? Divide it. Ask my client with peak flow of 85%. What do you think? Sickle cell client with chest pain and dyspnea. Client with emphysema per sleeping when ambulating. Client with end-stage liver disease with hysteresis. Stop the video, pick one of the answers. Then after that, see what I'm going to tell you. Listen to it and then pay attention with the strategy and use it to answer all the questions. Did you pick an answer? Yeah, I know. And I know you picked the right answer. Which one is the right answer? Number 2 is the right answer. Why? A sickle cell patient with the chest pain and dyspnea, this is acute chest syndrome. Patient has acute problem. We need to figure out this can lead to cardiac problem and pulmonary issue. What is the other ones? Why they are not the right answer? Asthma patient with the peak flow of 85, that's a good thing. Anything above 80 is a good thing. The patient is in the green zone, so we're not going to worry about it. Emphysema patient, what do? When you're walking, you're going to make some adaptation per sleeping so that you can walk better. That's a good thing, right? End-stage liver disease has what? Hysteresis. This is what? Encephalopathy. That's bad, but that's the second patient you should see. You should worry about somebody who have chest pain and dyspnea due to what? Sickle cell. This is acute coronary, acute chest syndrome, and that patient needs to be seen because if you don't, they're going to get into trouble. After that, we're going to see the end-stage liver disease with hysteresis. That's the second patient you're going to see. How did you do? I know you get the right answer, but I want you to follow the strategy. Use the B sharp and see who is going to die. Second question, who should be seen first? Same thing. Pediatric unit has 4 clients. What is the problem? 1 child, otitis media and ear pain. A child with sickle cell disease and new chest pain. A child with low-grade fever after vaccine. A child awaiting discharge teaching. I know you know the right answer. Which one did you pick? But I can tell you the right answer is the same thing, sickle cell patient. Compared to all these patients, that patient B is the one who is sick. Otitis media, there's no problem with it. That's a ear infection. Low-grade fever after vaccine is an expected finding. And if you're waiting for discharge, you have no problem. If you have sickle cell with the new chest pain, same thing, chest syndrome. That's a bad problem. It's an acute situation. We need to see that patient really bad. That patient is dangerous. Number 3, same thing, prioritization. Which client in the emergency room waiting area should be brought back first? Who we need to see first so that we don't get into trouble, right? A client with a sprained ankle. What do you think? Client with black tarry stool and dizziness. Client with acute mania and pacing. Client with sudden confusion and slurred speech. Who do you think needs your help? Who is more dangerous? You pause the video, you pick an answer choice, and then you play. Which one did you pick? I hope you pick somebody who had sudden confusion and slurred speech because that's stroke. Why? Stroke patient is more dangerous. Compared to acute mania, that's a psychotic problem. We have to see them, but they're pacing. They are not immediate threat to anybody. Black tarry stool and dizziness, that's bleeding, right? You bleeding, probably patient may be bleeding from GI bleeding, but a patient who has stroke is more dangerous than somebody who is just bleeding. So don't get trapped from it. The sprained ankle is the last patient we're going to see. So D is the right answer. And this is the key concept I want you to pay attention. And as you can see, the rationale, stroke is more urgent. It's a sudden neurological problem compared to somebody who may be bleeding. But probably, if I want you to pick the answer, I will have put something there to trick you that the patient is in shock. Right now, we don't have any shock, just dizziness and a black tarry stool. We need to see the confusion and the slurred speech. That's what stroke patient who is in trouble. Floor client arrived to the clinic. Which should the nurse assess first? That means they are in the clinic. Who need to be assessed first? Client with dysuria and urine frequency. What do you think? Client with flank pain, fever of 102 and chills. Client with chronic back pain requesting a refill. Client with right flank pain radiating to the groin and hematuria. Once again, they all have pain. Which pain is going to cause problem? That's what the B sharp is. If you need more, check Adaptation class. But which one would you pick? And which one is your right answer? And pause the video as usual and pick one that I know you will pick is right because you've been watching Adaptation class and I'm trying to make prioritization easy as much as possible. You can see this patient may have pyelonephritis. If you have frank pain, fever and chills, you have kidney infection itself, the kidney, that's pyelonephritis. If you have dysuria and urine frequency, it's called cystitis. That's the bladder infection. So if I draw the two kidney here and I bring it to the bladder, infection here is called cystitis. But when you have infection here in the kidney itself, that is pyelo. This is more dangerous than that. If you have chronic back pain, you're requesting pain medication, it's not a problem. If you have frank pain, same thing, radiating to your groin, that is kidney stone, that's nephrolithiasis. Therefore, which one is more dangerous is what? Pyelonephritis, that's number 2. And it's better than that one with cystitis versus what? Nephrolithiasis. So you got to know the difference, which one is more dangerous and which one you need to see first. 4 questions, 4 prioritization. How do you do? I hope you get 4 out of 4. But if not, let's keep on going, master the strategy, and then I know next time you do well. Make this count. Number 5. This one is a little bit difficult, but it's not. You just have to pick the question and the answer choice apart, and you figure it out. Which client should the nurse see first? The nurse is working in the emergency department when 4 clients arrive at the same time. Triage nursing. Based on this, who do you see? 65-year-old, what? Heart failure, reporting shortness of breath and oxygen saturation of 88, roommate. 25-year-old with the sprained ankle and a severe edema. 45-year-old with the rash, with mild itching after eating peanuts, speaking in full sentences. 32-year-old with sutured laceration of the forearm, reporting mild pain. As usual, pause the video, pick your answer so that you can answer this question yourself and keep your score and let me know. But I can tell you the right answer is who? Number 1. Why? Because this is a CHF patient. What is the problem? Shortness of breath. It's having breathing issue. Oxygen saturation is going down. We got to give that patient oxygen. Probably they have pulmonary edema. A sprained ankle and a severe edema is an expected finding. Give them pain medication, raise the leg, wrap it, ice, right? 45-year with the rash, it's not a good thing, right? And itchiness after eating peanut. But what is the answer choice that give it away that is not a priority? Patient speaking in full sentences. There's no airway issue right now. A is having airway issue. So we take precedent over somebody we think may be having allergic reaction. But right now, speaking in full sentences versus my saturation is in 88 and I have shortness of breath, you have to see me. If you have a laceration that is being sutured and there's no problem, we don't have to see you. So 1 is better. And this is assigned to 4 clients who arrive simultaneously after motor vehicle collision. Based on their condition, who do you need to see first? Same thing, triage nursing. Triage nursing, who do you see? The concept is what? Any person you can save is the one you see. If you have severe injury, forget about it. If the patient has severe injury and you cannot save them, forget about it. So don't go for severe injury. Look for what? Airway problem and bleeding. Chest injury is always number 1. A 34-year, 5-year-old with traumatic below knee amputation. You know this patient may be bleeding. A 42-year-old with the chest trauma, paradoxical chest rise. What do you think? A 30-year-old with the head trauma and exposed brain tissue, right? Brain tissue is exposed, bad head injury. 45-year-old with the back trauma and unable to move the lower extremities, most likely spinal cord injury. So who do you want to see? I'll give you the concept. Pause the video, pick your answer, and let me know which one you will see. As you can see, the person we need to see is number 2B. Why? Chest trauma, paradoxical chest rise is what? Flake chest. That's it. Probably they have bad pneumothorax, bad multiple rib fractures. We need to see them. Traumatic below knee amputation may be bleeding, but there's no evidence in the question, in the answer choice, telling you the patient is in shock. A trauma with exposed brain. When your brain tissue is exposed, you're dead. There's nothing I can do. If you are not able to move your lower extremities after injury to your back, you have spinal cord injury. But you are not in basically movement issue. There's no any evidence of autonomic dysreflexia or anything like that. All I see, you can't move your leg. Well, you can talk, you can speak, you can do anything. Number 2 is in trouble. Chest trauma, paradoxical chest rise is a problem. Triage nursing made easy. Which client is appropriate for a float nurse from the Med Surg to the cardiac unit? What do you think? We now move to delegation assignment. Which client is appropriate? It's a float nurse. When a float nurse go to the cardiac unit, never give them any patient that is more serious or is not predictable or is specific for the unit. Therefore, give them somebody every nurse can take care of it. That's why she's a float. She's not a cardiac nurse. Therefore, a fresh post-op open heart surgery patient, will you give it to them? Patient is ventilated for pneumonia. Will you give it to them? Client receiving what? Tissue plasminogen activator infusion, TPA. Will you give it to a floating nurse, right? To the ICU. A COPD patient on 2 liters oxygen and per sleeping when walking. Who is more dangerous? Who is more demanding? Who has so many problems? That's the answer choice. That's the concept. Like I said, every question, I'll give you a concept, write it down, and pick the right answer. Open heart surgery, too much for the float nurse. Patient is ventilated. It's not a problem, but it's pneumonia. But there's somebody there that is better. TPA can bleed and they have stroke again. COPD patient is stable. It's on 2 liters. There's nothing. Saturation is not going. He's just walking with per sleeping, doing what he's supposed to do. Therefore, appropriate for a float nurse. Which of the following tasks will be appropriate for the RN to assign to the LPN? What does the LPN does? They monitor, they reinforce, right? Special tests, to feed. Those are the things you need to pay attention to. And if you watch on my video, I call them MMR most, right? That means they can give most medication, they can monitor, they can reinforce, they can do stomach care, they can provide some tube feeding. Therefore, initial assessment of sepsis is not part of what I told you. Reinforce is the word we talk about, reinforce. So far as I see reinforce, that's the one I'm going to pick. Record intake and output of a client with CHF, that's in and out. They can measure urine output. That's not bad, right? Develop plan of care for a client with CHF. That's inappropriate. Plan of care, they cannot do that, right? Interpretate ABG for a client with asthma. They should not be doing that. That's the nurse's job. Therefore, reinforcement is what they can do, and they cannot develop plan of care. They can record in and out. This is a straightforward delegation work question for LPN. That's all. Same strategy. Which client is most appropriate for the LPN? A newly admitted with what? Chest pain. Do you think we should give that patient to an LPN? Client receiving tube feeding and has capped what? Tracheostomy. That means the tracheostomy is covered. Client requiring discharge teaching. Is the appropriate for the LPN? Client with what? Changing mental status. Who do you think is appropriate? Pause the video, pick your answer, and let me know. But this management of care, is about 17 to 25% of your test. That's why I always do management of care with prioritization, delegation, some ethics so that you can be comfortable. You need to master this portion of your NCLEX. You have to. Therefore, who do you think is appropriate for LPN? A newly admitted with the chest pain, need assessment, inappropriate. Patient with the tube feed, they can do tube feeding, they can do stoma. Tracheostomy is a form of stoma, but this stoma is capped. It's a tracheostomy. Capped, that means it's been covered. Patient is not even using it anymore. Client requiring discharge teaching, need provide teaching by the RN. Changing mental status need to be assessed. Therefore, this patient proceed. Which instruction by the RN to the LPN is appropriate? Same thing, same thinking, different language. It does not matter. When they give you delegation question, they can change the word, but pay attention where the tax is coming from and to who. Instruction, that means it's a form of tax. I'm giving you instruction as an LPN to do based on what you're capable of doing. Assess the patient lung sound. Ambulate the client using the guilt belt. Evaluate the incision for me. Teach a worker use for a client. Don't get trapped. Same strategy. What is in the scope of practice of the LPN? That's all. And then pick an answer. Did you pick one? Once again, I want you to pick answer for every question. You pause the video and pick an answer. Which one do you pick? Of course, ambulating a client is the easiest thing because this requires assessment, this requires evaluation, and this requires teaching. These are all done by what? The RN. So B is the right answer. And then in a UAP are caring for several clients. Which tax is appropriate for the UAP? Now we go to the UAP. The strategy for UAP, anything that does not require thinking and ADL. So if you see ADL, pick it. Anything that does not require thinking, that means no assessments, no evaluation, no teaching, nothing like that. Obtain daily weight for a heart failure client. Weight. Teach incentive spirometer usage. Teaching. Assess a new onset rash. Assess. Evaluate pain after IV medication. Evaluate. Which one is appropriate for a UAP? I don't want to make the question difficult. When it comes to delegation, don't make it difficult. There's no way they can trap you. It's straightforward. Use the concept. I just said ADLs and what? Anything that does not require thinking. Obtaining weight does not require thinking. Teaching requires some form of thinking. Assessment requires some form of thinking. Evaluate requires some form of thinking. So that's the only thing appropriate for the UAP. A Med Surg nurse is floated to the cardiac unit. Same thing. Med Surg to cardiac unit. It's a floater. Don't give them anything that is not specialized to them, but only specialized to the unit. Therefore, give them something that is predictable, that is not hard. That's all. Which client is most appropriate for the nurse to care for? Client admitted with what? Acute MI receiving nitroglycerin infusion. Client with the heart failure or require daily weight and oral medication. Client 2 hours post-cardiac catheterization with what? Frank ecchymosis. Client with the new onset atrial fibrillation receiving IV what? Diltiazem. Pause the video. Pick your answer and put it in the comment. I want to know, number 12, which answer choice did you pick? What do you think? Which one is appropriate for a floater nurse? I can tell you. Let's break down the answer choices first before I can tell you that, so that you can pick one. Now, admitted with what? MI is receiving what? High maintenance medication. I have CHF, all I need is a daily weight and oral medication. I have cardiac catheterization, but frank ecchymosis is not good. New onset AFib, I have diltiazem. That's a drip. The patient that is appropriate for the floater nurse is what? Giving oral medication and checking weight. That is the easiest thing. Predictable patient. MI is still receiving infusion of nitroglycerin and not out of the wood yet. Cardiac catheterization with the frank ecchymosis, that's bleeding. Atrial fibrillation is still receiving what? IV diltiazem, that means it's not stable yet. Therefore, that's the patient we see them. A confused client trying to leave AMA, management of care, the same thing. This is what ethics information. What is the next action? Physically restrain the client and call security. Allow the client to leave immediately after signing consent. Ask family to sign consent. Assess decision-making capacity. This is ethics. Ethics nursing is very important when it comes to management of care. There's certain things you have to know how it flows. Patient want to leave AMA. Pick one answer, let me know. What do you think? The concept, after you pick your answer, I know you stop the video, you pick an answer. The concept is what? Patient can leave AMA, but you need to assess whether the decision they're making is appropriate in their head, whether they have capacity. If they're confused, they can. So assess for capacity, let the nurse know, let the provider know, and then we let the patient sign consent. Before we let them sign consent, we got to tell them about the risks of leaving the hospital and the problem. Therefore, restraining them, you're going to get into trouble. That's like you are in trouble if you restrain the patient when they leave AMA. We can't let them leave AMA just like that without not figure out why, assessing them, letting the doctor know. That's not safe. Family are not allowed to sign consent for a patient to leave. So assess for capacity, let the doctor know, and the rest, we can figure it out. The child requires a blood transfusion to treat life-threatening anemia. The child's mother states, I do not consent to a blood transfusion for my child because of our religious belief. What is the next best action? Respect the mother's wishes and withhold the transfusion. Ask another family member to provide consent. Notify the care provider. Proceed with the transfusion because the child's life is at risk. Which one would you pick? Like I said, ethics, legality, you have to master them. That's always life. I can tell you the right answer, let the doctor know. Why? A mother, parent has a right to refuse care for a patient. But they specific, if the refusal is a life-threatening situation. In this, we need blood for a life-threatening situation. They cannot do that. We got to save. If they have religious issue and they don't want the kid to be like piercing your ear or circumcision, yeah, it's not life-threatening situation. But if I need the blood and I don't get the blood, I'm going to die. Mother and parents cannot do that. We can't allow them to let the kid die because of their religious belief. Therefore, we got to intervene. Let the doctor know there's going to be a court order required, and all these steps has to be taken. Respecting their wishes and withholding transfusion, bad decision. Asking family member to provide consent, bad decision. Providing the transfusion, that's bothering. The mother is receiving or the father is receiving. You can't give it to them even though they're refusing, but you got to go through the channel. Let the doctor know, and then we can figure out the associated information that need to be transferred to the court, and the court will give orders. Look, parents generally have the right to make medical decisions for their child. However, when a refusal places a child at serious risk for harm and death, the care team must act in the child's best interest. In this situation, the child cannot talk. We got to act in their best interest. 15, and nurse is participating in the quality improvement project to evaluate a procedure that is commonly performed on the unit, which piece of information will best provide data on the efficacy of the procedure. It's a bunch of things. And one, the number of staff members trained to perform the procedure, the average time it takes to complete the procedure, the cost of supply required for each procedure, the incidence of complication related to the procedure. I'm going to show you something. When people see this kind of question, management of care about procedures and other things, don't freak out. Go back to the question. There's always an answer choice there that will give you information to use it to answer it. Let me break it down to you. A piece of information, that means which of this? it's best to provide what? Efficacy of the procedure. What is the issue? A nurse is participating in what? Quality project to evaluate a procedure that is done in the unit. So those are the keywords. There's a procedure done in the unit all the time, and the nurse is what? What is the nurse doing? Doing something to find efficacy. That means how good is the thing. Therefore, what do you need to evaluate whether the thing is good? The number of staff members who can perform it, that means that's education. It has nothing to do with efficacy. Efficacy is outcome. Is it beneficial? Is there a complication? Is there anything associated with that is good for the patient? The average time it takes to complete the procedure, it's talking about time. It has nothing to do with efficacy. That is efficiency. This is talking about being efficient. That's time. The cost of supply required for each is talking about cost. The incidency of complication. Yeah, when I do the procedure, how many people get into trouble? Like if you put the IV in or the Foley catheter in, how many get infection? Based on the procedure you describe, it tells you about the efficacy. And that is the right answer. The efficacy is how good it is, what is the outcome, and that's what you should be looking for. Preparing to transfer a client 48 hours after abdominal surgery to a long-term facility. Which of the following information should the nurse include in the transfer or transfer report? Selected apply. Diagnosis and surgical procedure. Current medication and allergies. Vital signs on the day of admission. Dietary needs or restriction. Advanced directives, activity level and mobility restriction. Medical history, type of anesthesia use. What do you think? If you have to transfer a specific patient after surgery, 2 days after surgery, what are you going to include in the transfer? That's all the question is asking you. You don't have to pick everything. It's a select apply. This is what management of care. These are specific things you want to know about the patient if you're receiving them. What do you think? Put down your answer, and then I'll give you the rationale for the right answers. And I'll give you a mnemonic for this specific question if you see it again. Did you pick an answer? Of course, I know you did one. There's a lot of answer there because I want to teach you something about transfer of patient. It's a key NCLEX concept, so write it down. First, we have to know the diagnosis and surgical procedure that's appropriate. What is the patient medication they are on right now? It's also very important. The vitals is the current vitals, not the vitals on admission. It's been more than 48 hours. They're doing fine. Whatever the time you're transferring them, that's the vitals we need. So we don't need the vitals on a day of admission. So don't get trapped. What is their dietary restriction and what they need right now? It's very important so that we can feed them. What is their code status? That's advanced directive. Are they DNR or DNI or what? They are full code. I need to know as a nurse receiving this patient. Restriction. Do they have fracture? Do they need crutches? Mobility level. Family medical history is irrelevant at this point when you're transferring a patient. It's not going to provide any information to whoever is receiving them. And a type of anesthesia, I don't care whether they were intubated or they get spinal anesthesia. It's been 48 hours. I don't need to know. So how do you recognize when you see questions like that? This is Adaptation and NCLEX mnemonic. DAM-V. If you transfer a patient, the D is the diagnosis, the surgery that they had done. Allergies or any medication associated with it is the A. And the M is anything we need to monitor. Foley catheter, vitals, drains, anything. And then E is the eating, right? Restriction. And V is the vitals activity associated with that. So always give the DAM-V report to a nurse. Write it down. That's a concept whenever you're transferring a patient. Next question. This is a good thing to know. I want you to put it down. I put it here. End of care live, right? End of care is very, very important. And NCLEX love it because when a patient is about to die, there's certain things you can do. You can classify it as best care and basic care and comfort. But put it in the management of care because there's a very important information that you need to know. A nurse has attended a staff education program about palliative care, which statement by the nurse indicate follow-up teaching is required. That means they're saying something wrong. That's all what the question is asking you, and write it down. Use that to answer the question. That's all. Any wrong statement about palliative care is the right answer. Palliative care can be provided along with what? Curative treatment. That means it's not palliative, but curative. We're trying to fix the problem. The goal of palliative care is to improve quality of life. Is that what we do it for? Palliative care is only appropriate for clients who are at what? The end of life. Do you do palliative care for patient who is about to die? Palliative care focuses on relief of pain and other distressing symptoms. Put an answer and let me know. Stop the video, think about it. I give you the concept. The right answer is what? What do you think? Is C. You can have palliative care at the beginning of your diagnosis, not when you're about to die. If you get diagnosed with cancer, you can have palliative care right now. When you get into the end of imminent death, yeah, when you end of your cancer, you've had treatment and there's nothing to be done, you can also receive palliative. That's the key. NCLEX love to ask. I want you to write it down that palliative care can be initiated in the beginning or in the end or in the middle. And don't forget that. Of course, palliative care can be provided along with curative treatment. That's why C is wrong, because A is saying something different. What is the goal? Is to provide improved quality of life and to prevent anything that will be distressing for you. So know that, and they will ask this particular question regarding palliative care. You have to understand it. It's different from hospice. Hospice is the end of life, but palliative care can be started any stage of the illness. If you need more, check my basic care and basic care and comfort videos and try to master them, because they are good information to know about them. This is also the same thing. A nurse is caring for a client experiencing nausea, anorexia related to end-of-life care. Which medication should the nurse recommend to help manage these symptoms? Select and apply. Ondansetron, metoclopramide, dexamethasone, megastrine acetate, morphine, and dronabinol. What do you think? What is the question asking you? Breaking down. The key concept they asking is about what? Anorexia related to end of life. When you're about to die, end of life, you start having nausea, anorexia. It's an expected finding. If you want to feed the patient, there's certain strategy you can institute. Which medication can help with that? That's all. You pick an answer, it's a select and apply. Don't pick everything. Pick those that you're 100% confident about. As usual, that's a Dr. NCLEX way to master select and apply. That's SATA way of answering. Most of my questions are SATA, and the way to answer them, pick those you're confident and make sure you break down the question. Nausea, anorexia, ondansetron is used as an antiemetic. It's very good for that. Metoclopramide can increase GI motility, and that can improve their appetite. Steroid is also good for that. Megase is number one. That is used to improve appetite. It's a stimulant to appetite. Your appetite will improve. Morphine can decrease your respiratory rate. It does not improve appetite. And dronabinol is like of cannabis. This is the same thing. You stimulate your appetite and you can eat. So that's really good. That's another answer choice. How are you doing so far? Number 19. Let's continue with the end of life care question. And this is just to consolidate everything. Which findings should the nurse explain as signs of imminent death? How do I know this patient who is in end of life care is about to die? Select all that apply. At this certain time, a few minutes before you're about to die, there's specific things that happen physiologically. That's what the question is asking. A nurse is providing teaching to a family of a client receiving end of life care. Which findings should the nurse explain as signs of imminent death? Decreased urine output, cold motor extremities, increased appetite and diet. Period of apnea with irregular respiration, restlessness or terminal agitation, increased responsiveness and what? Alertness. The concept I will give you, and stop the video and use it to answer the question. When you're about to die, at the later point of time, everything goes down, except what? Agitation. You become restless. Why? Hypoxia. Low oxygen, you become agitated, you become restless. It's a sign that you're about to die. The rest, everything goes down. So what are your answers? I know you got that based on that concept. And you can see every question, there's a concept. When you grab the concept, the answer choice is easy. Try to approach every question like that. Use the concept to answer it. Therefore, I know decrease urine output, everything goes down. Cold extremities, everything going down. Your appetite is not going to increase based on the previous answer choice we saw. And based on the concept I told you about, period of apnea and irregular respiration, things are going down. You're not going to have increased responsiveness and alertness since everything is going down. And that's all. This is preparing a client for a scheduled abdominal aortic aneurysm. It's a bad surgery, right? Bad problem. While completing the perioperative checklist on the morning of surgery, the client states, I don't want this surgery anymore. Which action should the nurse take? It's an ethics question. Continue perioperative preparation and reassure the client. Ask the client to sign a refusal form and proceed with surgery. Stop perioperative care and notify the healthcare provider. Explain the consent was already signed and surgery must continue. What do you think? This is ethics question, ethics and legality for management of care. Did you pick an answer? What the question is asking you? Patient said, I don't want surgery, but it's a bad surgery. What do I mean by bad surgery? You need to have the surgery in order to get cured from it. Otherwise, he's going to die. But he said he does not want it. What do you want to do? Continue pre-operative preparation and reassuring the client is not appropriate. Wrong answer. Ask the client to sign a refusal form and proceed with surgery. Yes, they can sign a refusal form, but they should not proceed with surgery. Stop the perioperative care and notify the healthcare provider. That's appropriate. You don't need to explain that you already signed the consent and therefore he should continue. He has right to refuse even when they get to the operative room. You got to respect their autonomy. So that is the right answer. 20th question. How did you do so far? Management of care. We talk about prioritization. We talk about delegation. We talk about assignment. Some little bit of ethics. And then we talk about some basic care and comfort a little bit under that. But now we're moving to what? Pharmacology. Pharmacology are very distressing, but I'm going to make it easy. Stick around. If you need to get something to drink, go get it. I'm going to show you strategy to answer these questions straightforward. What do we have? Which statement by the client will require follow-up? Wrong answer. They're saying something wrong. The nurse is teaching the client with stable angina, chest pain problem, who has what? New prescription for what? Sublingual nitroglycerin. It means sublingual. That means under the tongue. Which one require follow-up? I will take one tablet if I feel chest pain and call 911 if it doesn't improve. Is that okay? Does that need follow-up? I can take up to 3 doses of nitroglycerin 5 times, 5 minutes apart if needed. What do you think? I will wait 50 minutes before calling 911 if the pain isn't relieved after 3 doses. Lay down while taking the medication to avoid dizziness. Which statement require follow-up? You pick an answer. This is a classic NCLEX question. They like asking about nitro, and this information I've given you is what they ask you. You pick an answer. Which one require follow-up? 3 require follow-up. I will wait 15 minutes. No, when your pain does not get better, you need to call 911. Then take another pill. That's wrong answer. Waiting 15 minutes is wrong. I will take 1 tablet if I feel chest pain, and I will call 911 if it isn't improved, because it's saying opposite to C. That's why A is right answer. You will take 3 doses every 5 minutes. So C is saying take 3 doses before you call 911. That is the wrong answer. And because it causes hypotension, you should lay down. So C, we need to intervene. Which assessment finding will require the nurse to intervene immediately. That means something bad is happening. And nurse is assessing the client with hypertension 1 hour after the first dose of what? Propranolol for anxiety. Propranolol is a beta blocker. It's a non-selective beta blocker. Which finding do you need to intervene? It's asking you about what? Side effect. Therefore, if you know it's a side effect, pick an answer that relates to side effect. Heart rate is 60. Dizziness upon standing. Inspiration, wheezing. Mild cough. What do you think? Do you pick an answer? I can tell you, wheezing is an unexpected finding. Therefore, that's the right answer. Why? Propranolol is a non-selective beta blocker. If a non-selective beta blocker, it can cause bronchoconstriction. I see bronchoconstriction, bad side effect. Heart rate is 60, is still within normal range. Dizziness, your blood pressure drop a little bit, not bad. You have mild cough, it's okay. But when you have wheezing, bronchoconstriction, I'm worried about it. Those are the little things you have to use to answer pharmacology. An unexpected finding that is very worrisome. Same strategy. Which finding indicate that the medication is effective, underlying effective. That means it's working. If it's working, it's effective. What medication? And this is caring for a 45-year-old who has AFib and is taking what? Verapamil. Which of these indicate effectiveness? Heart rate has decreased to 76. Blood pressure has increased to 140. Respiratory rate has decreased to 14. Absence of what? Premature atrial contraction. How do I know the medication is being effective? The reason why I'm taking it is happening. Which answer choice did you pick? Remember, it's a calcium channel blocker. What it's going to do? Slow down your heart rate. Your heart rate, and I'm using it for AFib. If I have AFib, well, I'm going to decrease my heart rate. This is good. The blood pressure increased to that. That's not what it's going to do. It doesn't mean it is effective. Respiratory rate decreased to 14. It does not affect your respiratory rate. Absence of premature atrial contraction. That is not what it's doing when I give it to you for AFib. Therefore, the right answer, effective one, is decreasing your heart rate, is the best answer choice. And this is the way you have to think about it. And you have to know it's not that you have to think too much, but sometimes you have to know what they're dealing with you. You know, if blood pressure increase, it doesn't indicate effectiveness. Premature atrial contraction is unrelated to verapamil, even though it sounds very bad, but it has nothing to do with the question. What is your score so far in pharmacology? Number 3, which client assessment finding indicate the need for frequent monitoring of what? Serum digoxin level. That's the key. If you don't understand that statement, then don't proceed with the question. Make sure you understand. There's something that requires to monitor digoxin. An elderly client who has chronic kidney disease, hypertension, AFib, is prescribing what? Digoxin. He has so many things that can affect digoxin. The kidney is not working, right? Kidney take care of digoxin to clear it out. Hypertension, right? AFib, right? But if I see glucose of 110, do I need to monitor digoxin? Well, heart rate of 62, serum creatinine of 2.8, blood pressure of 140. Which finding will make me worry that I need to monitor digoxin? Otherwise, I have digoxin toxicity. That is what the question is asking you. And then you got to go back to your concept of digoxin, right? What is that? Creatinine is the right answer because the kidney clear digoxin. If you have abnormal kidney function, digoxin build up and you have a problem. Blood glucose has nothing to do with digoxin. Heart rate of 62 is still within normal range. It's not that bad. It's 60. Adults, you need at least 60. Less than 60, we are still in 62. So there's no heart block. Blood pressure is fine. Therefore, serum creatinine is the problem. I just want to consolidate cardiac pharmacology so that you can understand how they work and what class of medication they involve. This is a bunch of what? Diuretic for you. Can you put it together? Which class? After attending staff education program about classes of diuretic, Which drug should the nurse match to the respective classes? These are all diuretic. You have carbonic anhydrase inhibitor, potassium sparing, we have loop diuretic, you have thiazide and osmotic medication. Which class do you put them? Stop the video, pair them yourself, and let me know. And I want you to know, put down in the comments, number 25 about diuretics. Carbonic anhydrase is acetazolamine. This we use it in usually if you have urine problem and other thing or glaucoma, you can use it to pull fluid from the eye. Potassium sparing is spironolactone, classic. Osmotic diuresis is what? Mannitol. And loop diuretic is furosemide. And of course, clothyridine is what? Thiazide related. All these are diuretic that you need to know about. So that's the pairing here. Those calculations, don't run away. Those calculations, don't run away. If you have problem with it, check Adaptation class. I have an easy way to calculate them. But this is a straightforward question. It has a bunch of words. Don't worry. A healthcare provider ordered 120 milligrams of what? Rabiprazole sodium in apple juice. Okay. How many packs of the medication should the nurse mix in the cup of apple juice? Don't run away. Once again, don't get defeated. Let's click on it. Most of the time, if they give you a picture, once again, write it down. If they give you a picture, all the answer choice is on the picture. Most of the information is on the picture. The question does not give you that much information. What do you see in this picture? I see a medication name. I don't care about it. That is the name of the medication. I see a dose. It says 40 milligrams. Okay. But what do I see? It says it's a delay released. And it said, this is equivalent to what? 40 milligrams of that. And it comes in packs. You see, there's 30 packs in it. That means one pack has what? 40 milligrams. That's all. And there's 30 packs in that bottle. That's all. That means every pack contains 40 milligrams of the medication. You don't have to stress anymore. You already answered the choice. Question. They say healthcare provider ordered what? 120 milligrams of the medication. So 120 milligrams of the medication. How much packs do I need? I was told one pack is what? 40. Therefore, I need to make sure the pack is on the top. So 40 milligrams times one pack. That's all. And therefore, these cancel this. And we have what? 3 packs. Therefore, we're going to give the patient 3 packs. Straightforward dimensional analysis. You don't have to overthink it. And that's the right answer. And that's the way you calculate it. We are on those calculations. Buckle up. I want you to buckle up. Healthcare provider ordered 1 unit of PRBC over 2 hours. The nurse will set the infusion pump at what? Dash per drip per minute. Answer to the nearest whole number. What you need to do, you just click on the image. It will give you information. You said it's an O negative blood. Okay. Red blood cell. I can see is red. 1 unit is 250 ml. Unfortunately, the blood is expired. Who cares? But that's not the point. We want to what? Use it to calculate. 1 unit is equal to 250 ml. We're going to use dimensional analysis. Therefore, based on what you've seen, this 1 unit is 250 ml, right? But you need one more thing. You cannot transfuse the blood without knowing the drop factor. The drop factor for blood transfusion is 10. So 10 drip per what? ml. And therefore, this is what we're going to use. Just write your answer choice in dimensional analysis. We know 250 ml, we're going to transfuse it over 2 hours. And we just convert, because the answer is in minutes, we have to convert it. So 1 hour here is 60 minutes. That's all. And this has done the job. Now, bring your drop factor is 10 drops per what? ml. And then cancel it out. 2 hours cancel. 2 go here, 2 log. What? 125. So that's taken care of. Now you have 10 and 60. These go into here. So we have 125 over 6 drops per minute. And this will give you what? 20.8. In the end, when you run it out, you get 21. So 21 drops per minute. This is the way you calculate this blood transfusion. It looks complicated, but it's dimensional analysis. Write it down. Stop this video. Continue to do it multiple times. You can see that it became easy. And so that's our right answer. We're going to put here is what? And so that's our right answer. 21 ml, 21 drops per minute. And this is the calculation. As I've told you, that's how you can calculate it. Next question is the same thing. A client is admitted with a DKA. The healthcare provider prescribed continuous IV insulin infusion at 0.1 unit per kilo per hour. And the client weighs 70 kilos. Don't worry about it. The pharmacy supply insulin at what? 100 units in ml of 0.9 normal saline. There's a bunch of words there you don't have to use. At what rate ml per hour would the nurse set the infusion? Whenever you see these dose calculation, don't run away. Just set things up. They want you to calculate ml per hour. I write it at my answer. They give you a unit per kilo per hour. And it said the patient is 70 kilos. Fine. And the pharmacy is supplying 100 units per ml. I know I need ml to be on top because there's ml. So for that, I'll write 100 ml over what? 100 units. That's the first step. And I see a unit here. I need to convert it. 0.1 unit so that the unit can cancel. I write 0.1 unit here. And under 0.1 unit, there's kilos. And there is what? 1 hour. Because the answer is in hour, I just leave it. So I already cancel units. But I see kilo here. The patient weighs what? 70 kilos. You got to multiply by 70 kilos. And in the process, you have what? 100 ml. I see ml there. Good. And everything is here. So 100 times 0.1 times 70 over 100 times an hour. So this cancel that. 100 cancel 100. 0.1 times 70 is equal to what? 70 ml per hour. Straightforward calculation. And that's what the nurse should set the rate. That's your right answer. And this is the way to do it. You can take a picture of it, but that's how you break it down. Dose calculation, pharmacology. Don't worry, I got you. Now, let's get to it. What is the next priority action? A child receiving carbamazepine for seizures develop fever and sore throat. What do you think? Give them acetaminophen, continue medication as ordered, notify provider immediately, encourage fluid intake. What do you think? The concept I want to tell you is don't forget that carbamazepine causes granulocytosis. Therefore, if I see fever and sore throat, bad problem, bad problem, bad problem. Don't treat with acetaminophen. Let the doctor know. Otherwise, we are in trouble. The rest of the answer choice are irrelevant. I'm going for the buzzword. The buzzword is patient is going to die. Which prescription from the healthcare provider the nurse should clarify? I should clarify it. That means it does not jive well. A nurse is caring for a client with mania on lithium. If you have mania and you're on lithium, which of these you shouldn't take? That's all. Bupropion, risperidone, valproic acid, Motrin, high-calorie diet. You pick your answer. You stop the video. You pick yours. Of course, if you're in mania, we got to give you high-calorie diet. That's good. We should not do anything that will affect your kidney. I'm going to question Motrin. Valproic acid is anti-epileptic. It can be used for mania. Risperidone is antipsychotic. It can be used for mania. Bupropion will make you more agitated. Therefore, mania patient should not take it. Those are the ones we question. Those are the answer choice. Bipolar patient should avoid this. Which finding will require a call to the healthcare provider by the nurse. Risk reduction and what? This is rescue thinking. You're just seeing something and calling the doctor quickly. And nurse is caring for a client who is prescribed what? Clozapine for psychosis. Psychosis, I'm giving you antipsychotic, second generation antipsychotic. That's what I'm giving you. Therefore, what do you want to do? Malaise, dry mouth, bladder distension, constipation. This is a test-taking strategy. I want you to stop the video and I want to know which answer choice you pick for this particular question. Which one would you call the doctor? Malaise, dry mouth, bladder distension, constipation. I can tell you the right answer is malaise. Why? Clozapine causes agranulocytosis, and infection is agranulocytosis, a bad problem. Malaise is a form of infection. That's the beginning of sepsis. We should report it. Dry mouth, bladder distension, and constipation are associated with the anticholinergic effect of clozapine, a second generation antipsychotic. We should not worry about it. This may be hard, but strategy will help you answer it. Next question. A nurse is what? What is the problem? A nurse is reviewing prescription for 4 clients. Which prescription should the nurse question? Bad combination. That means they are not doing what they're supposed to do, or they're going to cause harm to the patient. Amoxicillin and metamizole for depression. Clomipramine and saline nasal spray for depression. Bupropion and lithium in bipolar. Citrulline and diazepam in anxiety disorder patient. What do you think that we should question? All you need to do, see if the combination are okay. Did you pick an answer choice? Let me know. Stop the video. Once again, stop the video and work with me. Then you answer the question. Amlodipine. He's a TCA. He has anticholinergic effect. Metamizole will prevent you from getting constipation. This is good. Clomipramine, anticholinergic effect, right? It's a TCA. Drying nose and mouth, right? We give you nasal spray to help with. Bupropion, we know, I told you, bipolar patients should not take it. Citrulline, SSRI, anxiety medication, they do different. You can take it. Some patient with anxiety, some patient with depression can take it. This is a bad combination. And let's care for a client with asthma, bad way, due for the following prescription, morning medication: propranolol, albuterol, Montelukast, Docosate, isosorbide mononitrate. These are all medication that is due. Based on the clinical data, which prescription the nurse should question? Patient temperature is fine. Heart rate is 125, is too high. Blood pressure is too high. Respiratory rate is going up. Saturation is 98, is good. PO2 is 85. Look at it carefully. Therefore, based on that, should we give the patient propranolol? Do you think we should do that? Let me know. Do we give them albuterol, Montelukast, Docosate, isosorbide? Heart rate is too high. Therefore, albuterol, we're not going to give it to them. Propranolol, patients asthma. Why would you give them asthma? Why would you give them medication that will cause them to have bronchospasm? Therefore, this, even though it's used for hypertension, we're not going to give it to the patient. So propranolol, albuterol are bad. Montelukast is a long-term for the asthma. Docosate is for constipation. Isosorbide is a nitrate. It may lower the blood pressure. So those ones the patient can get. Otherwise, it's contraindicated. NS is caring for a child with asthma. Prescribe Montelukast. I told you long-term therapy. Which teaching is correct? Is based on the concept. Use this medication during acute asthma attack. Give 1 dose daily in the evening. Take with a short-acting bronchodilator. Discontinue if symptoms improved. Which one is appropriate? Pick your answer. Let me know. And let me know what you think. What is the question asking? It's asking you, what is the treatment of asthma using Montelukast? And what do you need to know? Montelukast is a long term. Therefore, don't use it in acute situation. A is wrong. You're going to take it daily. It's not short-acting bronchodilator. And you should not just stop using it right away. So that's the right answer. A client taking acetazolamide, I told you, is carbonic anhydrase medication. It's a diuretic. You can use it for glaucoma. Should be monitored for what adverse effect, what is the major side effect associated with this medication. Write it down. If you don't know, you stop this video, number 35, put it down. Anytime you see this medication, that should be the first thing that pop up from in your mind. That's what the NCLEX is going to ask you. Acetazolamide. It looks like a loop diuretic. It's a loop diuretic, but it has specific side effect. You pick an answer? Because of the enzyme, it causes metabolic acidosis. In the process, it causes hypokalemia. And therefore, it has nothing to do with bradycardia, hypoglycemia. But know it, acetazolamide is what? Medication for glaucoma. It's a diuretic. What is the problem? It can cause metabolic acidosis and hypokalemia. Know that. Very, very important. NCLEX love it. That's why I put it NCLEX steps. This is Adaptation NCLEX Q Bank. And this is where I pull some of my questions from. Acetazolamide is an acid-base alert. Monitor for metabolic acidosis and electrolyte imbalance, which is what? Hypokalemia. A nurse is reviewing new prescription for a client with rheumatoid arthritis and a history of heart attack. Rheumatoid arthritis. Which medication require follow-up? That means you should not take it if he has heart attack. It can be used for rheumatoid, but it can complicate heart problem. That's what he's asking you. I'm giving you the key concept, how to break down the question, write it on your own so that you can hone it. Require follow-up. That means, should I take NSAID if you have rheumatoid arthritis and heart MI, methotrexate, celecoxib, prednisone? Should I take them if I have others? There's something telling you you should not pick one answer choice. There's something telling you there's one that is bad. There's something telling you there's one they should not take. And that is what? Celebrex. It causes heart problem. It has black box warning on it. That is all contraindicated in cardiovascular disease. You see the questions? It's a concept. If you write it down, trust me, if you go take any practice test in any Q bank anywhere, that's what they're going to ask you. If you go take the NCLEX, those are the concepts they're going to ask you. I take some of the things I think is relevant and I create these questions for you. So master them. Don't memorize the answers, just know the concept. A client receiving vancomycin IV begin to have diffuse flushing and redness on the neck and chest. Which action is appropriate? Slow the infusion down, stop the medication and prepare for epinephrine, give diphenhydramine and continue the infusion, reassure the client this is expected and continue. What do you think? Which answer choice do you pick? I can tell you this is the right answer. 37. It's what? Red mind syndrome. When I give you IV vancomycin, you're going to have red mind syndrome. It doesn't mean I should stop the medication and forget about it. Giving you epinephrine, you think it's an allergy. Diphenhydramine, you think it's an allergy. Reassuring the client that it's expected, so you should continue the rate is unexpected. You should slow it down because you're running too fast, and that is it. We are on 38 questions, NCLEX practice questions, NCLEX review questions, NCLEX questions and answers, high yield fact, 85 questions on all the things you need to answer it. How are you doing so far? 38 questions. What do you think? We're on pharmacology. Buckle up. If they are hard, that's the intention. So that when you go take the NCLEX, it's a practice run. Which medication should the nurse expect? And a client develop watery diarrhea and abdominal pain after ceftriaxone and is diagnosed with what? C. diff. What prescription should you expect? Ampicillin, cefepime, metronidazole, clindamycin. You pick an answer? You know the answer? You have to know it because you watch Adaptation class. So what do you think? What is the question asking you? Client developed watery diarrhea and abdominal pain after taking antibiotic and is diagnosed with C. diff. All this, forget about it. Sometimes you give you so much information. You don't need this. You don't need this. All you need to know is patient has C. diff. What is the management of C. diff? That's all. There's a medication we use for C. diff. Ampicillin, I won't pick ampicillin because the patient was taking ceftriaxone. They will be cross-linking, and therefore it can cause the same problem. I won't take cefepime because it's the same thing, medication, same class of medication, teaching you sticking strategy. And then you left with C and D. Metronidazole is the easy medication that is used for C. diff or vancomycin. Those are the two. Write it down. Metronidazole and vancomycin. You don't use clindamycin because it causes C. diff too. Those are the right answers. NS is caring for a client on a cardiac unit who is taking warfarin. Which of the following is contraindicated? That means if you take your warfarin, it causes bleeding, which medication you should not take? Rewrite the question. Tomato, broccoli, soy pomate, and tofu. Any of these causes bleeding? Soy pomate. It causes bleeding. Therefore, you should not take it. The rest of it has nothing to do with bleeding. They don't cause bleeding issue. Therefore, we're good. Which response should the nurse provide? What do you think? A client with coronary disease is prescribed sublingual isosorbide mononitrate for chest pain. It does not matter. It's taking some nitrate for chest pain. After placing the tablet under the tongue is sublingual. You put it in the right place. Client report burning and tingling sensation. What do you think? The medication, what will you tell the patient? The medication may have been exposed to sunlight and therefore it's not working. Drink a bunch of water after the tablet dissolve. Is that what you should tell the patient? Stop taking the medication until your prescriber evaluates you. A mild burning sensation is expected. What do you think? What do you think? Is this what you tell the patient? Is this what you should tell the patient? What is your right answer? What is your right answer? What is your right answer? Which answer choice will you pick? Burning sensation means the medication is working and therefore it's an expected finding. You should not stop taking it. You should not drink water with it. It's a sublingual. Therefore, don't worry about it. Unexpected finding. NGN type of question. Don't run away from me. I got you. We've moved from pharmacology. We did pharmacology. What is your score? About 20 medications on pharmacology. I would like to know, how did you score? Now, a nurse is preparing to provide postmortem care for a deceased client. Which action are appropriate? Select or apply. This is basic care and comfort. If you need help in basic care of comfort, Adaptation class is the home of basic care and comfort. Check it. You see a bunch of video. But this is postmortem care. What do you need to do? All these questions, everything you know, every question they ask you about postmortem care, come back here. Do you open the client eyes and mouth gently for drainage? Should you place the client in the supine position with the arms at the side? Should you remove tubes and lines? Do you clean the body and remove all soil linen? Do you remove the dentures? Do you apply clean gown and fresh linen? Do you allow the family to spend time with the patient? Which one is appropriate? You should close the eyes. No, it's not appropriate. You can place their arms on their side, but you should lift their head up. Head should be upright to allow blood to drain. Otherwise, the good face is going to be not nice. Therefore, this is not good. You should not remove tubes and lines because they may do autopsy. So don't do that. You should clean the body. That's fine. Leave the dentures alone to make sure their face is shaped that way. Anything that is dirty, you can clean it, and the family can spend time with the patient. This is it. Take a picture of it and never get any of this wrong. If you have done it before, this is the way they're going to ask you. Okay? Basic care and comfort. And this is caring for a premature infant in the neonate intensive care unit. Which nursing action in the plan of care is appropriate? We have a premature. It's a basic care and comfort, therefore related to comfort and basic care. Reposition the infant at least every 2 hours. Use alcohol swabs to remove monitoring legs. Apply lotions, moisturizer to dry areas as prescribed. Use hydrogel or silicone-based adhesive tape to secure IV tubing. Pad pressure points with soft positioning device. Bath the infant daily with soap and water. What do you think? You can see this is all talking about the kid's skin. Premature skin break easily. That's the concept. Pick something. Don't over-select. Don't be greedy. Pick those you're 100% confident. If you don't understand it, leave it alone. I can tell you, turning the infant prevent pressure injury. That's good. Alcohol is going to dry the skin. Don't use it on the skin. Apply moisturizer. It's a good thing on the kid's skin. And then when you want to secure with the tape, don't use any other tape. Use hydrogel silicone one. Easy to peel. And pad any pressure point. Don't bath the kid excessively. Skin get dry, they get into trouble. So that's the right answer. And these can be trappy, but it's basic care and comfort. You carry master skin integrity, and that's what the NCLEX will ask you. Same thing. And then is assisting an older adult client who is at risk of fall. We're talking about fall risks to ambulate in the hallway. Which nursing action promote injury prevention during ambulation? Rewrite the question, a bunch of words, forget about it. Don't use my words, use your own words. Stop the video, use your own words to answer this. What is the 2 sentences telling you? How do you prevent fall in the patient who is walking? It's a high risk of fall. So what do you want to do? Use a gait belt before assisting the client. Ensure the client is wearing a non-skate footwear. Walk slightly behind and on the client's weaker side. Encourage the client to look at the floor while walking. Clear the pathway of cluster and loose cords. Allow the client to ambulate with minimal assistance to promote independence. Just think about each question and see what he's telling you. I don't want you to memorize these questions. Don't memorize them. Don't memorize the answer. Think about it clinically. Let this be like a mock exam. Thinking about it. What would you do if this patient is going to fall? How would I prevent the fall? That's all. Apply a gate bed because that will prevent. Earliest thing you can do, the easiest thing you can do is that. And then wear non-skid so that you don't fall. Their weaker side is where they're going to fall. So be there. They should not look on the floor. They're going to trip. Wrong answer. You should clear anything that will cause them to trip. And they should not walk alone just because you want to promote independence. The questions say high risks of fall. Therefore, we're not going to do that. That's a trap. And then is assisting the client with limited mobility to ambulate. That means he can't move at all. Which action help prevent injury to the nurse while providing care? It's the opposite. Now, you don't the patient falling, but you want to protect yourself so that you don't get injured in the patient who is more likely to fall. I want you to do that. When you use your own ways to understand the question, it's easy. I'm walking the patient, and now I want to prevent myself from getting injured. The patient is more likely to fall. Keep the client close to the next center of gravity. Is that what you want to do? Bend at the waist when the client begins to lose balance. Use a gait belt to assist with balance and support. Widen the base of the support by placing feet shoulder width apart. Pivot the feet instead of what? Twisting the waist or the torso. Attempt to hold the client upright if they begin to fall. This portion of basic care and comfort is a little bit difficult. It's movement, mobility. The NCLEX love it because you don't want to cause injury. What do you want to do? Stop the video. Don't overselect. If it doesn't make sense to you, just let it go. But analyze it. What can you do to prevent injury to yourself? Hey, your center of gravity is where your energy is. So that's where you're going to put it. You should not bend at your waist when the client begins to lose balance. No, don't do that. You're going to injure yourself. Wrong answer. Use a gate bed to assist with balance. That's your best friend. And you give yourself wide base support so that you can support them. You should not twist your torso. If you do that, it's a problem. Is that right? Pivot the feet instead of twisting. Yes, your feet is the base, but don't twist your torso. And if they're falling, don't hold them. Let them fall on your leg and gently lower them. So don't hold the client upright if they begin to fall. They'll break you down. Just gently let them fall down on your leg. Give them your leg and then let them fall on your leg. These are some of the things NCLEX will ask you. If you don't know, I want you to take a picture of it. And this is the key. I'm giving you free concept. Take a picture of it. Never let that question beat you anymore. And this is assessing several clients of medical surgical unit. Which client is at increased risk of what? Developing pressure injury. So pressure injury, select and apply. A client with what? Spinal cord injury. An older adult with what? Urinary incontinence and moist skin. A post-operative client with end-stage renal disease. A client who ambulate independently and eat all meals. Malnourished client with serum albumin of 2.5. A client with diabetes and decreased sensation in the feet. Who is more likely to develop pressure injury? Anybody who is malnourished, not moving, had other medical problems, are your key concepts. Write them down. Therefore, pick one. I know there's more than one answer choice there, and I know you know it. So pick more than one. Spinal cord patient is not going to move. Older client with incontinence, skin is going to break down. Post-op patient, renal failure, bad problem. Is going to get dialysis and all those things. They're not going to move. That's a big issue. A client who ambulate independently and eat all meals is mobile, no problem. A malnourished client with serum albumin of 2.5 is a bad problem. Malnourished, no protein. A client with diabetes mellitus and decreased sensation, more likely to develop pressure injury because of the sensory changes, chronic condition. So those are risk factors you should know. And the best way to memorize them, I call them impaired, right? Impaired. I is immobility. M, moisture of the skin to prevent it. Poor nutrition is a bad problem. Altered sensation. They don't feel anything. Chronic illness, more likely to do that. And if there's decreased circulation, like PAD problem, these are the things that will cause his pressure injury. Know them, write them down, pay attention to them, and memorize them. If you see a question, that's how you can classify them. Which piece of equipment should the nurse use to promote safety during the transfer? We've seen it in the different form, in the selected apply. Now is one, but the answer choice is popping at the right there because you know equipment to prevent safety when I'm transferring a patient is right there. And nurse is assisting a client with right-sided stroke to transfer from a wheelchair to the bed. Right-sided stroke, that means what? That side is in trouble. And therefore, what would I do? I'm going to support the patient, but what can I use? Mechanical lift, transfer gate belt, slide board, and overbed trapeze. Which one is safe to transfer this patient? You can answer. Let me know. This is basic care and comfort. How are you doing with that? Are they hard? No. It's something you know. Apply your knowledge. Apply the concept. Mechanical lift is somebody who does not bear weight at all. This patient bear weight, so it's gone. It's the right answer. Transfer bed. Yeah, they can bear, and you can transfer them because one side is weaker. Slide board is basically you're moving them completely. Over trapeze is orthopedic injury patient. And so that's the way you can learn about this kind of mobility and transfer thing. And these are concepts you have to understand what you use, what you move with it, and how to apply it. Very important. If you're in nursing school, this is big. You have to know it. So that's the best thing to know. And I give you the answers how to understand what each of them function. Which position should the nurse take to ensure the client's safety? Okay, a nurse is assisting the client who has what? Right-sided stroke. I'm building up from the last question to ambulate for the first time. Patient has right-sided stroke. Where would you be when you're walking with the patient? Right-sided stroke, it means what? I'm going to walk in front of the client to guide each step. I'm going to be on the client left side. I'm going to be on the right side of the client, slightly behind them. I'm going to directly behind the client, holding both shoulders. Patient right side is affected, and therefore, this is where you're going to be. They are going to be on their weaker side. If I'm going to be on the weaker side, I stay on the right side. That's the easy way. The weaker side is where you provide support, and that's the easy way you can help with this patient. Which of the following findings should the nurse be most concerned about? Bad problem. A nurse is caring for a 3-year-old that's sickle cell who is admitted with what? Vaso-occlusive disease. He's in vaso-occlusive crisis. That means which one is more concerning? Patient has pain, 8 out of 10 in the hand. Pain, 8 out of 10 in the leg. Swelling of the hand and feet with pallor. Headache, 9 out of 10. What do you think? This is a test-taking strategy concept. I want to know if you watch and you're on 48, I would like to know what is your score. I will check this video online. I want to see how many people hate this one. Which one will you be concerned about? Vaso-occlusive disease in a sickle cell patient. You pick an answer? The right answer is this. With sickle cell patient and vaso-occlusive disease, your priority is acute chest syndrome, or they're going to get stroke. Headache is unexpected. When I see that severe headache, they are having stroke. They're going to have arm and leg pain. Their hands and feet will swell and they have pallor. It's unexpected finding. But if I see headache, priority. And then saw fire in the client's room. What is the next best action? Raise. Raise. That's what it is. I see fire. I'm going to raise. Remove the client from danger. Activate the fire alarm. Contain the fire. Evaluate the area. The thing is raise. So save somebody. I'm going to remove the person from there before I do anything. Which of the following statements need further education? After providing teaching to a client with diarrhea, patient has diarrhea. Which one need education? That means they're not saying something good or doing something bad. I will increase oral fluid intake. Is that okay when you have diarrhea? I will increase intake of brand food. Is that okay when you have diarrhea? I will increase intake of high fiber diet. Is that okay when you have diarrhea? I will avoid beverages with caffeine. Is that okay when you have diarrhea? When you have diarrhea, you don't want to stimulate anymore. Therefore, you're going to drink a bunch of fluid. That is good. Brand food is very soft. Therefore, it's good. It has less fiber in it. But high fiber diet will make you go more frequent. You have diarrhea. Caffeine, when you avoid it, is good because caffeine is a stimulant and let you have diarrhea. Therefore, this is good. Now, next generation question. I've gone through what? Management of care. We did pharmacology, basic care and comfort. Now let's do the next generation NCLEX case study. And you know how to approach them. They are not difficult. They're just designed to give you point. And I will show you how to get your point. But you have to understand what is going on. And when you get it, use it. I choose what? A mental health question, the one that people run away from it. And how do you read it? First 2 sentences should give you a clue. A 28 years old client present to the outpatient clinic. What is he doing? Accompanied by family member. Okay. The family member report that the client spent several hours each day washing his hands. Something should tell you, and cleaning the house surfaces non-stop. The client states, if I don't wash my hands exactly the right way, something terrible will happen. What do you think? All he does is wash his hands and clean things around. Client report feeling intense anxiety when unable to complete this routine. If he doesn't do it, he's just about feel like something is bad happening. The client appear what? Anxious? One. During interview, repeatedly using hand sanitizer, trying to clean his hand because it's going to be dirty. Report difficulty sleeping and stay. He has missed work due to time spent trying to clean, retune everything at home. The client denied there's no hallucination, there's no delusion, no thought of harming himself, no suicide. His vitals is normal. What do you think is going on? I've given you everything to answer the question. And as you can see, this is what obsessive compulsive behavior. Therefore, what? Which findings are most relevant to the nurse when he assessing them? What do you think? Washing your hands is relevant to me. Fear that the harm is at interfering is very important. Fear that the harm will occur ritual. If the rituals are not completed, it is affecting him. He has difficulty maintaining employment. It's affecting him. He's using hand sanitizer during the interview. Denying hallucination does not give you any warm feeling. So that's the one. Based on assessment data, which client concern should the nurse prioritize? Now, which one would you prioritize? Risks of self-directed violence, impaired functioning related to anxiety, disturbed sensory perception, or risks of infection? What do you think will you prioritize? This is the key concept of the question. Not because I'm worried about infection. You think so? Not because there is a sensory perception issue. He has no hallucination. It's because it's affecting his daily life, his work and everything. Not because he's going to harm himself, because I know OCD does not do that. Now, which nursing intervention is most appropriate to include in the plan of care? Do you stop the client from performing ritual immediately, right away? Stop completely. Allow time for ritual while gradually limiting their duration. Confront the client about irrational thought and encourage avoidance of anxiety-provoking situation. I use all the things I know they're going to ask you regarding OCD, and I create the concept in the case form. So what do you think you need to do when you're taking care of this patient? You should not take away the stimulant. Let them do it, but not 20 times, maybe 5 times, because then you create more anxiety and they get into trouble. So allow time for gradual timing on the duration of their problem. Which statement by the nurse is appropriate, most appropriate? You know these thoughts are not logic. You should stop. Is that okay? Therapeutic, right? Try to distract yourself when you feel anxious. Is that okay? I can see that this thought causes you distress. Let's talk about way to manage your anxiety. Is that okay? If you don't stop this behavior, your anxiety will worsen. Therapeutic communication, guys. Which one is the best therapeutic communication? What do you think? Which one is the best one? Tell me more about it. So working with the patient, I can see that it's distressing you. Let's work more about it and fix the problem. Now, the provider prescribed fluoxetine. It's an SSRI. You have to know them. Just recognize them. Which statement by the client indicate understanding of the medication? I should stop the medication once my symptoms improved. This medication may take several weeks before I can see improvement. I will only take this medication when I feel anxious. This medication works immediately to stop compulsive behavior. Test-taking strategy. It's a bunch of conflicted statements. Use that for your advantage. What is the conflicted questions? Answers. B said the medication may take several weeks. And the D said, what? This medication works immediately to stop compulsive. It does not. Therefore, better to take them, right? That's the key, right? Is that what you're looking for? The medication may take several weeks before I notice improvement, right? I should stop the medication once my symptoms? No. I will take this medication when I feel anxious? No. This medication work to stop? No. So the only thing that is more appropriate is that answer choice. Now, which outcome best indicate the plan of care? What is your best thing is effective? The client no longer experience anxiety. Is that your best? The client complete rituals without distress. The client report decreased time spent on rituals. The client avoid what? Situation that increases anxiety. What do you think? The effective way is not because they stop doing what they're doing. It's not they don't have anxiety. No, it's a client avoid situation. I'm avoiding situation that will create anxiety. It's because I'm not doing the amount of washing I was doing before. That is OCD. That's the concept I want you to take with you. And this is the right answer. So master it, know it, and underline it. These are some of the things you have to know when it comes to this test taking strategy with questions on case study. Next one. Are you ready? This is 2 questions, but I want to test your brain about it. The client presented to the emergency department reporting chest tightness, rapid heartbeat, dizziness, difficulty breathing. She appeared visibly distressed with diaphoresis, tremor, tearfulness. The client repeatedly stated, I am going to die from this heart attack. She's observed pacing in the room. The client reports recently starting fluoxetine as prescribed by the healthcare provider. She's like slightly what? Heart rate, this should be 110, 120 over that. So these are all the patient vitals. Echocardiogram is normal and chest x-ray is also normal. What do you think is going on with them? All these signs and symptoms is telling you. Client presented the emergency room, chest is raising, everything is going up. What do you think is wrong with this man? He said, I'm going to die if you don't do something. I'm going to die from this heart attack. But when we get it, EKG is normal, chest x-ray is normal. What do you think? Which for intervention should the nurse prioritize at this time? What do you think? Select or apply. This is what? Anxiety, panic attack. Therefore, anything that you're doing and you are not with the patient is a wrong answer. Remain with the client, provide assurance using calm, clear communication, encourage what? Slow, controlled breathing techniques, administer oxygen via nasal cannula, obtain a detailed cardiac history before intervening, reduce stimuli by moving the client to a quiet environment, prepare the client for immediate catheterization. The story sounds like panic attack. What would you do? Select 4. The concept is if you're with the patient, that's the best answer. If you are not, that's the wrong answer. So remain with the client is better. Provide assurance using calm, clear information is good. Encourage slow, controlled breathing technique is good. I'm with the patient. Oxygen is not providing any presence. Obtaining a detailed cardiac history, not this time around. Reduce the stimuli is much, much better. Patient does not need cardiac catheterization because this is not MI. Which assessment finding best supports the next decision to focus on anxiety reduction intervention rather than cardiac intervention? Because this is not a cardiac problem. Why? Which one tells you I should focus on that? Because the client has oxygen saturation of 98.9, his heart rate is 110, client is pacing and verbalizing fear of dying or sinus tachycardia. Which one tell you this is anxiety rather than cardiac problem? That's what it's actually. It's because it's pacing non-stop. And that's your right answer. 2 case study, mental health. If they were hard, go back, keep on watching them. Stop the video, and then play them on your own with the audio off. Then play the audio and see how I give you the explanation. It's a long question. Physiological adaptation. You see questions like that, take your time, read it. I intentionally said it like that. There's some that is highlighted. It's a reason why. A nurse is in the emergency department is assessing a client with type 1 diabetes who presents with what? Feeling very sick. The client report increased test, frequent urination over the past 2 days. The nurse note that the client appear weak and fatigued. Assessment finding include what? Respiration are deep and rapid. Breathing as what? Fluid odor. Skin is dry and warm. Heart rate is 110. Blood pressure is down. Have you seen these questions before? A bunch of information. You said, when would they end? Yes, this is practice run. Laboratory, I give you everything. Then you ask yourself, what am I asking you? Which of the highlighted findings are most concerning? That's all. What do you think? Do you make a diagnosis? Diabetes patient with all this? Patient is diabetic. Should that concern you? Patient has weak and fatigue. Should that concern you? Patient has deep, rapid breathing. Should that concern you? Patient has fruity odor. Should that concern you? Blood pressure is that and pH of that. That's acidosis. This tells you the patient is in what? What situation is this patient in? Patient is in what? Decay. And therefore, which finding indicate should concern you? Which one? They are weak, rapid breathing, through the other, that, and that. All this is concerning. Just having diabetes should not concern you. A DKA patient, all these things indicate that the patient is in DKA. Having diabetes, I won't worry about it, but signs and symptoms are consistent with DKA. And next is assessing a 10-year-old child with DKA. Which assessment findings are consistent with this condition? Select or apply. This is an NGN type of question. Like I said, physiological adaptation. How do you know this is a DKA? The kid is going to have abdominal pain, dry mucous memory, fruity smelling breath, rapid deep breathing, and a blood glucose of 750 and pH of that. What do you know about DKA? What expected finding do you see? Of course, abdominal pain, yes. They're going to get dry, mucous memory, yes. Fruity breath, of course, it's a DKA. They're going to have rapid deep breathing, expected finding. Their glucose will not be 750, and their pH is not going to be that. pH is supposed to go down, indicating acidosis. Therefore, this is no and no. This is the way you see in the DK. And this is assessing a client at the ophthalmology clinic who report gradual loss of peripheral vision. Your peripheral vision is going over the past 3 months. Which condition should the nurse suspect? Which condition causes loss of peripheral vision? This is a trap. If you overselect, you're going to go wrong. There's only one condition that causes peripheral vision problem. It's not retinal detachment, no cataract, no transit ischemia. That means acute, like they're having stroke. Macular degeneration is mostly central. Glaucoma is the only thing. It's just a trap. Don't overselect. Which condition does the nurse urgently suspect? Which one do I suspect? The nurse is assessing a client who reports shortness of breath. That means too much fluid. The nurse notes jugular vein distension and labored respiration. I'm trying to keep fluid, have shortness of breath, and JVD. What do you think? Look at the situation, what is happening. Look at the patient is having right-sided heart failure, right? Right? Something is happening, and it's happening so fast that I have shortness of breath, and then I have what? JVD associated with what? Labored breathing. Dehydration will not have you shortness of breath, so it's gone. SIDH, of course, you're going to have fluid overloaded, but in that situation, you're not going to have an acute situation where you're going to have JVD, labile respiration. You're going to be fluid overloaded. This look like all in at strain, right-sided strain. This is due to pulmonary edema. JVD shortness of breath is all right-sided strain of your heart. And next, assessing a client with right flank pain radiating to the umbilicus, pH fever of 101.5 in dysuria. This is what? Which condition is most likely? Draw your diagram, and you have to know what each of them causes. We talked about this before. Pyelonephritis, you have frank pain, you have fever, it go to the umbilicus. Kidney stone, frank pain, it go to your groin, no umbilicus. Cystitis, it deal with your bladder. BPH, down here near your prostate. Therefore, this is pyelonephritis. It's a differential diagnosis question to be able to master them. We're dealing with physiological adaptation. These questions can be hard, but look, I try to make them hard so that you can use them as a practice run. The client with the COPD is receiving oxygen via nasal cannula of 6 liters. Bad problem. Right there should tell you something should be triggering. Which action is appropriate? Continue the oxygen as prescribed, reduce the flow rate, and consider ventral max, change to non-rebreather, discontinue oxygen immediately. Well, COPD patient, what do you think? What kind of oxygen should we give it? And if we see it, what should you do? Which one should you intervene? I expect you to pick that we need to reduce the flow rate and put them on a precise oxygen delivery device. They get ventral max. The rest are all bad choices. And as is teaching a client with grave disease is scheduled for what? Radioactive iodine therapy. With teaching point, should the nurse include? Select and apply. Notify the provider with excessive weight gain. Use effective birth control. Sugar-free gum for dry mouth. Sleep in the separate room if possible. All secretion are radioactive. Maximum effect may take 3 months. What is the concept? Radioactive iodine radiation, everything is on fire. We need to prevent exposure. All your secretion are all radioactive. Therefore, what do you want to do? Which answer choice do you want to choose? Let everybody know that if you're gaining excessive weight, you have what? Hypothyroidism, bad problem. You should not get pregnant because you're getting radiation. Your mouth is going to dry, supposed to choose something. You should sleep in a separate environment because of what? What do you think? You are radioactive, or your secretion are radioactive, and this can take 3 to 6 months. And so that's the things you have to know. I want you to take a picture of this particular question. I give you everything they're going to ask you. Some of them are learning questions, and I want you to know about it. Physiological adaptation. You expect EKG. Don't run away from me. Just step back. Figure out what I'm asking you. It may be easy. All you need to do is read the EKG. Which action should the nurse take first? About what? The nurse is caring for a client without pulse. No pulse. Okay. Cardiac monitor show what? I have no pulse, but I have a rhythm. It means pulseless electrical activity. That's what we call PEA. When I see PEA, that means pulseless electrical activity is the same thing as this patient has asystole. I'm giving you a clue. If I have asystole, what would that do then? Synchronized cardioversion, immediate defibrillation, high quality CPR, epinephrine. If I have asystole, what is the first thing I would do? Put on their chest, push on their chest, and give them fire. They don't need any electricity first. They have fire. The client cardiac monitor showed this. How will you name this? How do you read EKG? See if the rhythm is sinus. I can see from here to here, here to here, here to here is sinus. I see P waves everywhere. The QRS look fine. But what is wrong with this? You can see from PR interval is long. That's the only problem with this EKG. Otherwise, this is a normal EKG. Therefore, I know it's sinus breathing, and it's not normal sinus reading. It's a first degree heart block. Second degree cannot be because there may be drop. There's heavy P wave associated with the QRS, P wave QRS, P wave QRS. So it cannot be a complete heart block. There's dissociation between the atrium and the ventricle. So this is a first degree heart block, which action by the nurse need immediate intervention by the supervising nurse. You see, we switch. You finish physiological adaptation. I'm taking you to what? Infectious control. I use all the things the NCLEX will ask you. If you're able to score high in this test, you are ready to go. Which action by the nurse need immediate intervention by the supervising nurse? Wearing gloves and gown when entering the client room. Using alcohol-based hand sanitizer after removing the gloves. Placing the client in the private room. Using dedicated equipment for the client. Ask yourself, what do I need for Clostridium? Difficile. What do I need? Contact precaution. What is contact precaution? Wear gown and gloves before you go to the room. You should wash your hands, not alcohol-based. You should keep the client in the private room and then use dedicated equipment. That's all. Don't overthink it. Wash your hands with sedative. Which client should be placed in airborne? Know your airborne organism. MTVS, whatever acronym you know. But even if you don't know, look at each of them. Pertussis, tuberculosis, MRSA, C. diff. We just saw C. diff. We know it's contact. It's gone. MRSA is also contact. Tuberculosis, airborne. Pertussis is droplet. Therefore, this one. Which of the following measures should the nurse take when caring for a client? Select or apply. A nurse is admitting a client who will require isolation precaution for active TB. Active TB, you know, we did it. It's what? I try to do a progression so that you can use it, know it. TB is what? Airborne. Therefore, which one should you institute? You, the nurse, wear filtration masks during client care. Admit the client to a private room with negative pressure airflow. Have the client wear a mask when leaving the room. Have the client wear a gown when leaving the room. Clean the door, close the door to the client's room. What do you think? Airborne precaution? What do you need? Which one is appropriate for airborne? Select and apply. You got to wear N95. That's appropriate, you the nurse. Client is in a negative pressure room. That's good. Client wears surgical mask when they leave in the room. It does not need to wear a gown. And the patient door should be closed at all times. If you need help with infectious control, check NCLEX. But this is coming, whether you like it or not. NCLEX is going to ask you this. That's why I make them hard so that when you do go, it will be easy, especially for this measles, a bunch of information. I'm just using words trying to change the information. Which of the following strategy would the nurse implement to prevent spread of infection in the patient who have measles? Put it in the group. What is measles? Airborne. And therefore, airborne, what kind of precaution do I need? That's all. Don't make it difficult. Don't add anything. Use N95, negative pressure room. Use water impermeable gown during contact with the client. Use of water impermeable gown during what? Contact with the client belongings. Use of goggles and a face shield if there is likelihood of splashing of body fluid during an intervention. Use N95 mask, gown, gloves during routine care. Don respiratory mask before entering the client's room and removing before exiting the room. I'm using the same way. I'm changing a little bit to confuse you, but yay, to make you stronger. Client wear a face or a surgical mask when in negative pressure room is unavailable. What do you think? Of course, you're going to wear N95, you the nurse. What else? The client has to be in negative pressure room because it's airborne. Use the water impermeable gown during contact with the client. It's not contact precaution. It's a trap. Use of water impermeable gown during contact with the client belongs. It's not contact precaution. Forget about it. Use goggles and face shield if there's a likelihood of splash. Yes. Use N95 mask, gown, gloves during routine care. We already said you don't need gown and gloves. Therefore, don't pick it. Don respiratory masks before entering the client's room and remove it before you leave. Keep it on when you're leaving. And if there's no negative pressure room, the client wear what? Surgical mask. A hard question is not hard. It's just concept, and you stick with it. No matter how I trap you, you stick with it. Go back to this question. If you answer that, that means you master infectious control. 67. And this is expecting several clients from the emergency room. Which client need a private room? Lyme disease, hepatitis A, cryptococcus meningitis, E. coli, hepatitis C, toxic shock syndrome, Shigella syndrome. This is a trap. If you see this and you get it wrong, don't worry. But I want you to put down your answer in the comment. And I want to know what you selected. 67. Which one did you select? Stay here with me. Which one did you select? A private room is for something that is droplet, contact, or airborne. Lyme disease is a standard precaution. Hepatitis A, anybody with a standard precaution does not need a private room. Lyme disease, standard precaution. Hep A, it depends whether the patient is diapered or not diapered. I never put it there. So you got to pick it as a contact. Crypto meningitis, standard precaution. E. coli is what? Contact, therefore, private room. Hepatitis C, standard precaution. Toxic shock syndrome, standard precaution. Dysentery is what? What do you think? Contact precaution. This is the way you should approach these kind of questions. You just know what they're going to track you, and then you know the organism. If you need more, check Adaptation class. We move to safety. You got to do infectious control, then safety to prevent harm to the patient. And novice nurse has attended staff education program of neutropenic precaution. What is neutropenic precaution? Which action by the novice nurse indicate need for further teaching? That means they're doing things that is not consistent with what? Neutropenic precaution. The novice nurse don respiratory masks during routine care. The novice nurse recommend against raw fish when a client made the request for dinner. The novice nurse as a sign in front of the client door educating visitors of strict and hygiene. The novice nurse ensure every visitor dons surgical mask. The novice nurse refused to allow a visitor carrying a fresh flower as a get well soon gift into the client's room. What do you think? They say need further teaching, doing something bad. Therefore, pick answer choice than require further teaching. You don't need a respiratory mask, just a surgical mask. It's good to recommend against raw fish. It's good to have a sign that, hey, you got to wash your hands. Everybody wears surgical mask, and then no fresh flower. That's good. Select or apply. Neutropenic precaution. One answer. If you overpick, you get 0. So don't overselect. A nurse is providing teaching to a parent of a newborn at discharge. With teaching is appropriate. A, newborn, going on. Keep tummy during what? Keep tummy time during sleep to what? 30 minutes and supervise. Is that what you teach? Place the newborn in the prone position during sleep. Is that appropriate? Prone in a newborn. Absolutely no smoking in the house. You're preventing them from smoking. To prevent burn injury, check water temperature of water, bath water with the elbow. That's what you want to do. Set water temperature to 120. No toys or stuffing animal in the child's crib. Look at it carefully. Newborn, going on. What will you provide to the parent? That's all. You pick your answer, select and apply. If it's confusing, don't pick it. Of course, there's going to be some time. Usually you want to put them in the supine position, but sometimes in the tummy time, but it has to be supervised. That's why this is wrong. Newborn should never be in a prone position. You can provide some tummy time, short time while you're there watching. No smoking is good. It causes allergic reaction, respiratory infection. Use the elbow to check water temperature because that is the areas you can see how sensitive is the water. Your palm is too thick, the tissue there, the water temperature will be too high. You will not feel it. When you put your hand in the water and using your palm, the skin is so thick, the temperature will be higher. But when you use your elbow, you can see it touches you. It's mostly hot. Water temperature to this 120 is good. And no toys or stuffing animal in the crib. Otherwise, the kid is going to suffocate. Take a picture of this. Newborn safety precautions. A nurse is caring for a client receiving oxygen therapy via nasal cannula, which action require immediate intervention. The client is wearing synthetic blanket. The oxygen tubing is looped around under the bed rail. The humidifier bottle is half full. The client is in a semi-Fowler position. Somebody is getting oxygen. Which of these findings should you concern you? That's all. Which one should it concern you? All of them may be bad, but which one is so bad? Oxygen and synthetic blanket, they hate each other. Fire in the hole. That's bad. We can have oxygen tubing is looped under the bed rail. It's not bad, but hey, a synthetic blanket is going to catch fire. That is the key. Cotton blanket is much better. A confused elderly client with the history of fall is found climbing over the bed. You can see safety can be hard, but you got it. Adaptation got you. I'm showing you the tricks to pay attention which one is going to kill the patient, cause to harm. What is the most appropriate nursing action? History of fall, found climbing over the bed. What would you do? Stop it? Apply restraint to prevent injury? Lower the bed to the lowest position? Administer a sedative? Keep the bed raised up to prevent patient from getting out of bed. It's a trap. Trap question. And don't get trapped. Adaptation class doesn't like to trap you. Restraint is not appropriate. Sedation is a form of restraint, inappropriate. Raising the bed rail, they will jump over. They're more likely to fall. Keep the bed in the lowest position so that when they get up, they won't fall. These are test-taking strategy I'm using to teach you. Which behavior in a client with Alzheimer's require priority intervention by the nurse. That means the behavior indicates something is bad is happening. That's the concept. Look at the answer choice and see if something is bad. Asking repetitive question. Does that mean something is bad? Forgetting names. Does that mean something is bad? Difficulty dressing. Does that mean something is bad? When they're wondering, does that mean something is bad? Which one should concern you? I know you know the right answer. If they're wondering, something is bad. Anxiety in this patient, you got to figure out. They're more likely to fall. They're more likely to injure themselves, and you got to figure it out. The client become increasingly agitated and yelling and pacing in the room. Safety, safety, safety. Is the client yelling, pacing, moving around? Which action is the most appropriate? This is key. The nurse is seeing this patient moving around. What would you do? Speak slowly and calmly. Use short, simple sentence. Maintain a short distance, a safe distance. Keep hands visible, relaxed posture. Set clear, respectful limits. Reduce stimuli and leave the client alone if unsafe. Violence is something the NCLEX like to ask you. That's what I'm asking you. What would you do? In this situation, patient is agitated, is yelling, is pacing. Select or apply. Don't over-select. You want me to give you the clue? Watch the video, pick your answer, and I'll give you your clue. The key is calm before you do anything. So speak slowly, use short sentence, maintain your distance, make sure they can see your hand, a respectful limit, reduce stimuli that will agitate them. And this is a trap. Don't leave them alone. If you leave them alone, it can cause harm. When somebody is agitated, it's better to watch them and see what is going on. Leaving is always think is the best thing, but no, they may cause harm to themselves or somebody else. So never do that. And I give you explanation. Calm before control. Don't abandon the patient. Leaving them, basically, you can't monitor them anymore. You can't intervene. You cannot control them. The questions say action is appropriate. You should not leave them alone. Mental health concept. I have 3 good mental health concepts that will throw your mind. Don't leave. Come back and watch this. It may be trappy, but it's designed for that. It's good to know the difference between delusion and hallucination, and that's what this is testing. For each client statement, indicate whether the finding is most consistent with delusion or hallucination. The FBI has placed a tracking device in my brain. What do you think? Do you think this is delusion or hallucination? I hear a voice telling me not to trust the nurse. The television newscaster is sending me a secret message. I see spiders crawling on the wall, but no one else can see them. My thoughts are being broadcast so everyone can hear them. What do you think? How do you answer this question? Concept. Delusion is a fixed belief. Hallucination is a perception. Something is there, but it's not there. Or you can feel it, it's not there. So don't forget the two, delusion and hallucination. FBI has placed a tracking device in my brain. It's not perception. It's a belief I know for sure. Therefore, this is what? Delusion. I hear voices telling me not to trust the nurse. I hear it's a perception, right? It's not the fixed belief. I hear it, right? Auditory hallucination. The television newscaster is sending me a secret, talking to me, believing, receiving a message. Delusion. I see a spider. What is the problem? Crawling on the wall, but no one sees it because it's not there. There's no there's perception problem. Hallucination. My thoughts are being broadcast so everyone can hear them. Fixed belief. That's delusion. Know the difference between them. Like I said, the key way to understand them is what? Delusion is a false fixed belief despite evidence. Hallucination is what? Sensory perception without actual stimuli. There's nothing there. So I can hear it, I can see it, tactile, auditory, or smelling is what? I believe, I think is delusion. I see, I hear, I feel is hallucination. Now, there's one more. Illusion. People don't talk about it. NCLEX may ask you, what is illusion? Which client statement is more consistent with illusion? And then it's assessing the client and a psychiatric unit. Which one is an illusion? I hear voices telling me I'm worthless. The coat hanging on the door looked like a person standing there. The government has implanted a chip in my brain. I see bugs crawling under my skin. You see, I said perception on the skin, hearing, vision is hallucination. When you have fixed thought is what? Delusion. But what is illusion? Illusion means something is there, but you represent it abnormal. It's different from hallucination The thing is not there. Illusion is there, but you call it something else. So which answer choice means you are having illusion? I know you picked the right answer. And thank you for staying. 75 question. Adapting class. Got you. This is what coat hanging there on the door look like a person. It's a coat. It's not the person. That's what illusion. I hear voices is hallucination. Government implanted something is delusion. A bug crawling on my skin is hallucination. You got it? Never get it wrong anymore. And this is preparing to administer enoxaparin to a client who has what BMI of 40. This is what fundamentals. Fundamentals. I leave that to the last 4 questions, and we're done dealing with fundamental skills that you need to know of nursing. Which action is appropriate? How do you inject enoxaparin? It's what? It's a subcutaneous medication. But what is the problem? BMI of 40. There's a reason why I put it there. Therefore, which answer choice would you pick? I told you subcutaneous, intradermal, intramuscular is gone because the patient is big, 90 degrees. We're going to put it at 90 degrees angle subcu, not intramuscular, not intradermal. So C is your right answer. A charge nurse is discussing principles of indwelling catheter protocol with new graduate. Which of the following should the charge nurse include in the discussion? All it means is what? We'll come back to it. Hang the collecting bag above the level of the bladder, prevent loops in the tube, keep the collecting bag on the floor to ensure adequate drainage, empty the bag when 2/3 full, perform perineal care twice a shift with sterile water. You pick an answer choice? Select or apply. I know you picked them. Now let's break it down. A charge nurse is discussing principle of indwelling catheter protocol with a new graduate. Which of the following should the nurse, charge nurse include in the discussion? Means what are the protocol to use for Foley catheter? It's a bunch of stuff. What do you do when somebody has Foley catheter? What is the principle? That's all. What is the principle? Which one is the best principle? Hang the collecting bag above the level of the bladder. No, below. Therefore, this is wrong. Prevent loops in the tubes. Of course, yes, we should prevent tubes in the what? In the tubes. Keep the collecting bag on the floor. We should not keep the collecting bag on the floor to ensure adequate drainage. Empty the bag when 2/3 full. We should empty it when it's 1/3 full. Perform perineal care twice a shift with what? Sterile water. All the question is asking you, when you're taking care of a patient with the Foley catheter, what do? Select or apply. Which one would you pick? Don't over-select. Don't be greedy. Pick those you're 100% confident. Which one did you pick? Stop the video, pick your answer choice, and let me know. But I can tell you the bag should not hang above the level of the bladder. It should be below. One is wrong. You should prevent loops, yes, so that it can flow easily. The bag should not be on the floor. You can hang it on the bed rails. You should empty it when it's half full, not 2/3. And the perineal care twice with the sterile water. No, soap and water. Therefore, there's only one answer choice there. How are you doing so far? 2 questions left because of the case study. Therefore, what do you think? A new graduate nurse received the following prescription. Administer 1 amp of calcium gluconate, which action by the nurse indicate correct understanding how to prepare a medication with the amp. How do you prepare with the amp? Which one? Snap the ampule open away from the body using alcohol pad or gauze. Draw up the medication using a regular syringe without a filter needle. Inject air into the amp before withdrawing the medication. Shake the amp to mix the medication before drawing up. Which one indicate correct understanding? You're doing something good. You have to know how to prepare a amp of calcium gluconate. You should not mix it. You should not inject the hair into the arm before withdrawing. You should not draw up the medication using a regular syringe. You need some filter needle because of the glasses that can break it from you. That's the right answer. And the strategy is what? Amp must be open away from the body with the gauze and all alcohol part prevent injury because it break away. After opening, the medication should be withdrawn with what? A filter needed to prevent the glass particle from getting into it. That is the amp safety. Snap away, use the gauze and the filter needed. The filter needle is required to withdraw it. Then you can use an injecting needle. That's the key. That's the key. Filter needle to withdraw and use injecting needle. Last question. 78, 85 question. Thank you for staying around. Thank you for watching. Thank you for surviving. And I know you learned something. If you need more, check Adapt NCLEX. If this video helped you, let's put a little bit of comment so that we can grow this channel. These are 85 questions designed to make you pass. That's all. That's the purpose of this question. And I want you to learn the concept. I don't care what is your score. What I care about is whether you know the concept so that when you see similar questions, you can answer them. Similar one is this. Which action by the nurse is appropriate? Select and apply. A nurse is caring for a client who require a vest restraint to maintain safety. It's a vest. Restraint. Treat them like a restraint, any restraint you know. The specific associated with it. It's a vest. You wear it. Keep the client in the supine position. Do you think if I put the vest on you and lay you flat, you'll be okay? Place the vest restraint under the gown. You think I put the gown on top of the restraint is okay? Secure the restraint to the bed rails is okay. Obtain the air care provider prescription within the required framework of that vest and remove the restraint every 4 hours to provide range of motion exercise. You know it, just bring all the things you know about restraint and use it. Of course, you got to check on them every 2 hours. Therefore, this is a wrong answer. You need a prescription from the provider. The bed rails are not designed to use to tie what? You can't tie any restraint there because it's movable. The vest should be on top of the gown. And the client should never be supine because then they will aspirate. That's the key. 85 questions. Thank you for watching. Thank you for joining Adapt NCLEX today and watching this video. Like I said, if you like this video, put the comment there, put the like button, share with your friends, subscribe to Adapt NCLEX for more content like that. Good luck with this NCLEX practice question 85 NCLEX review questions. We talk about prioritization, pharmacology, management of care, basic care comfort, infectious control, mental health concept, fundamentals of nursing, everything you need to know. And each of them, we talk about medication, psych medication, cardiology, triage. You got it. Good luck and best of luck. Bye.